Call to order Health, Education, and Workload Committee, January 15th, 2020. The time is now 2 p.m. I'd like to ask Representative Deere to please give the invocation.
Great God, we thank you for this day. Thank you for this warm weather. Lord, we ask your blessings be upon us as we need and do be about the business of the nation. Lord, we thank you for your grace and your mercy upon us and for the blessing upon the family and for all the blessings of life. In the name of Jesus, I pray. Amen.
Roll call, April Lindsay.
Mary Crawford, present. Joyce Deere,
President.
James Jennings,
Here.
Anna Marshall, present. Lucia Tyson.
Present. Five present, zero absent, constitutes quorum. All business conducted will be official. Next item on the agenda will be the approval of minutes December 9th, 2019.
Chairman, I make a motion to approve the minutes for December 9, 2019, with any corrections as needed.
Representative Jennings made a motion to approve the minutes for December 9th, 2019 with any changes necessary. Seconded by Representative Deere. Discussion. Roll call vote, please.
Mary Crawford. Yes. Joyce Deere,
Yes.
James Jennings,
Yes.
Anna Marshall.
Yes.
One in favor, none against.
4 in favor, 0 against. The motion passed. Next item on the agenda, the order of business. Fire Department applications. Millfay Fire Department was postponed on 12/9/19. Rolling Hills Fire Department was postponed on 12/9/19.
I contacted both fire departments, and both fire departments could not be here today, and both have requested to be postponed until February's meeting.
Okay. Did I get that? Both of these were requested to be postponed. And they will be here for the February meeting, which is
February 12th.
February 12th. Everybody okay with that? Representative Jennings?
I just have a couple of comments on the applications. So this legislation was initiated in 1996. And so over the years, there's been some changes to it, amendments to it. So I think that the committee needs to go over it and review the application. One reason Rolling Hills was postponed because I didn't feel like that they were qualified. They're not a rural or a volunteer fire department. And I just think that we need to look at that. I've been in contact with the speaker to get with our attorney to see what he can do about that also. So that's just my comment. Thank you.
Thank you, Representative Jennings. Any other discussion? You have a motion to postpone these to February 12th? Representative Jennings made a motion to postpone both Millfay Fire Department as well as Rolling Hills Fire Department to February 12th meeting. Second by Representative Deere. Roll call.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deere.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. Both departments will be postponed and be on February 12th's HEW agenda. TR 20-001, a tribal resolution of the Muscogee Creek Nation authorizes the principal chief to execute a certain Visian letter of participation to access committed tier pricing on behalf of the Muscogee Creek Nation Department of Health. Sponsor is Representative Jennings.
Motion for a due pass.
Motion for a due pass, Representative Jennings.
Second.
Second by Representative Deere. Discussion. Representative Jennings.
Mr. President.
Afternoon, Mr. Chairman. How are you?
Chairman, thank you, Mr. Jennings, for that and committee. Chairman, if I could just make a brief statement about the document that I passed out beforehand for those council members that aren't familiar with that. Every piece of legislation that the Department of Health brings, we put together a book for you that month that kind of outlines what that legislation is going to be used for and why we're needing that. So you usually have that in front of you, and then at the end we have our health report that we'll go over at the end. So I just wanted to make you familiar. That's why we provide that book. So getting back to TR 2001. Vizient letter is a company that provides nuclear medicine, med supplies, pharmaceutical supplies, that as we are starting off our new nuke med program at the med center, and this just gives us a pricing schedule that if we buy so many drugs, we're getting it at this price. And this actual legislation is the limited waiver of sovereignty, that we usually do. So with that, I'm happy to answer any questions if you have any.
Questions from Mr. Terry? Representative Deere?
Were they recommended by somebody, or how did you choose?
They're a subsidiary of Cardinal Health, which is our big drug supplier. So there's only a couple of these in the country that are kind of national suppliers. So it's typically you're only get one of the two.
Representative Deere? Any questions for Mr. Terry? You're going to roll call over this?
James Jennings,
Yes.
Ann Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deere,
Yes.
William Rashford, in favor,
0 against.
1 in favor, 0 against, that motion passed. TR 20-002, the current resolution of Muskogee Creek Nation authorizing Principal Chief to execute a certain subscription agreement between the Muskogee Creek Nation Department of Health and Up to Date Inc. on behalf of the Muskogee Creek Nation Department of Health. Sponsored Representative Jennings.
Motion for due pass.
Motion for due pass, Representative Jennings.
Second.
Seconded by Representative Deere. Discussion. Representative Jennings.
Okay.
Thank you. Thank you once again. This is a software app that our physicians have been requesting that we're using some of our grant funds from, you know what grant? Anyway, it's a grant from behavioral health. This Up to Date Inc. is a software that allows doctors to kind of have a cheat sheet. So if you have a certain disease, they can type in that disease and it'll give them all the up-to-date treatments, and they have that all at their fingertips. So it's really like having a library, a medical library sitting here on your phone that you can tap into. So I think it's going to be a nice addition to our doctors and nice tool for them to use. And that's about as simple as that. So I'm be happy to answer any questions if you have any.
Questions?
I just want to, in just reviewing this, our office did not prepare this legislation, but there is language that needs to be included if we're agreeing to venue and lawsuits in the state of Massachusetts that they can only, or we're only waiving our sovereignty act of this contract. There's a little, do you know the language, Alicia? If we want to just include that, amend it to include that, that should it go to court, it's only limited to this contract and it's not an open-ended waiver of sovereign immunity.
Mr. Tork?
I don't have a copy of it in front of me. Just in that there's no, it's not a limited waiver, is that?
It's one of the be further resolved. It's a language that we normally put in that we're only waiving sovereign immunity as of this contract, and that they can only come after, we would only go to court. And I'm happy to send the
No,
language
yeah.
to you in the future too. I just, we just want to make sure we include that for any time we're agreeing to other courts or governing laws that we're only allowing the laws of either that state to apply just for this, or that we're only allowing to go to court for this contract, not just open-ended, we're not just waiving our sovereign immunity. So I just want to make sure we include that language.
Thank you, Mr. Representative Jennings. Make that amendment, please.
Just that extra where it says, just about that state, right?
I can email it, yeah, I can email you the little
Okay.
section.
I know what she's talking about.
I'll make that motion to amend it.
Representative Jennings made a motion to add language. Ms. Stovall, could you please give us the language again that we want to add, please?
Yes, sure. Yes, I can email it.
And so.
I don't know it right offhand, I can't recite it back to you, but I'm happy to email it to the sponsor, to Alicia, and Mr. Corbett, everyone that needs it.
Representative Jennings asked you to withdraw your motion, and we'll just substitute on the floor.
Okay.
Representative Jennings
Withdraw my motion.
withdraws his motion. Back to the main motion. Any more discussion on the main motion? Hearing none, roll call vote, please.
Jennings,
Yes.
Anna Marshall. Yes. Mayor Crawford.
Yes.
Joyce Deere.
Yes.
Chairman, you got 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-003. Control resolution of Muskogee Creek Nation authorizing principal chief to execute a certain lease agreement between the Muskogee Creek Nation Department of Health and 50 Bows Inc. on behalf of the Muskogee Creek Nation Department of Health, sponsored by Representative Jennings.
Motion for a due pass.
Motion for a due pass for Representative Jennings. Second by Representative Deere. Discussion. Representative Jennings.
Thank you. Once again, Piggy Bows, for those of you that are not familiar, is just the mail system we use to mail packages from the medical center, and that's what Piggy Bows is currently, what they currently provide for us. So that's really about the short of it. We are looking, if you're curious, at U.S. Postal Service, and we're going to have some discussions where we can have a more comprehensive Department of Health strategy for all of our mail services that we're conducting. But for right now, the medical center is still using 50 Bows, and we're just trying not to stop their services. And I'd be happy to answer your questions.
Questions, Commissioner? Roll call vote, please.
James Jennings,
Yes.
Anna Marshall. Mayor Crawford.
Yes.
Joyce Deere.
Yes.
Chairman, you got 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-004. A tribe resolution from the Muskogee Creek Nation authorizing principal chief to execute a memorandum of understanding between the Muskogee Creek Nation Department of Health and Oklahoma State Department of Health for the McIntosh County Community Assessment Project Building, GAP, sponsors Anna Marshall.
Do pass.
Representative Marshall made a motion for a due pass.
Second.
Second by Representative Jennings. Discussion. Motion. Sure.
Thank you so much for that. The Oklahoma State Department of Health has been working alongside our public health nurses to do some patient satisfaction surveying down in McIntosh County. And so we're supporting the public health nurses in their efforts to do that. So we're excited to be able to have that. Be happy to answer your questions.
Questions? Representative Jennings. Roll call, please.
Anna Marshall.
Yes.
Mayor Crawford.
Yes.
Joyce Deere.
Yes.
James Jennings.
Yes.
Chairman, you got 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-005, tribal resolution of the Muskogee Creek Nation authorizing principal chief to execute a memorandum of agreement with Wetumpka Public Schools to provide mentoring services to eligible Muskogee Creek youth. Sponsored Representative Marshall. Representative Marshall made a motion for a due pass. Second by Representative Deere. Discussion. Mr. Marshall? Discussion on this from you, or do you have a representative from the school here? Ms. Mason's here. Well, Ms. Mason, how are you?
Good, how are you doing?
So we are, good afternoon. We are launching a mentoring program with Wetumpka Public Schools. It'll be a pilot this semester. We're hoping to start in early February and go through the end of May. In future years, it'll be September through May. once a week. At this time, for 1 hour, we're seeking mentors if anybody's interested. This will apply to Missouri Creek Youth, and this agreement will allow us to basically use the facilities at the school. They're going to be doing that at no charge to us. We've located an after-school program that does feeding, and so they've applied for that service, so the students will get a light meal when they're with us. So just really outlining kind of some of the responsibilities and roles that each of us will have in this partnership. And I think it also allows for us to continue doing these in future years.
Thank you, Ms. Mason. Questions for Ms. Mason? Representative Buck.
Chairman, Nancy, do y'all partner with NYCP?
We work with
There.
them a lot, yes,
Oh,
definitely.
gotcha.
Representative Buck. Representative
Is this for all students then?
We're going to target 6th or 8th grade to begin with, and then as those kids get older, we'll expand to other grade levels. We're going to focus on Muscogee Creek youth initially, but also we would hope to serve other Native American youth in the future if we're able to get other grant funding and that kind of thing.
Representative Deere. Representative Marshall, questions? Questions? Representative Jennings. Call roll, please.
Anna Marshall?
Yes.
Mary Crawford?
Yes.
Joyce Deere?
Yes.
James Jennings? Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. Ms. Mason, consent agenda. PCA 20-001, a law of Muscogee Creek Nation authorizing expenditure of grant funds awarded from Oklahoma State University Office of Rural Health for the Small Hospital Improvement Program, SHIP, grant to the Muscogee Creek Nation Department of Health, sponsored Representative Crawford. Representative Crawford made a motion for a due pass. Second by Representative Deere. Discussion. Representative Crawford.
Thank you, Ms. Crawford. That this committee, this is a grant that the Okemah Hospital receives every year from Oklahoma State. And this year, we will be spending this on our patient satisfaction surveys inside the hospital. It's called HCAP scores. And it's really patient satisfaction, and this is going to really help with the projects that we're doing on studying our patient satisfaction and committees to improve that. So this funding authority will allow us to do that. And I'll be happy to answer any questions.
Representative Deere.
No, sir.
Representative Martin. Representative Crawford. Representative Jennings.
So, Mr. Terry, this letter from the state says that the reports must be publicly reported. So why are they going to be reported at?
I don't know publicly. I know that we'll submit those reports after they're done unless they publish them. I'm sure that, and HCAP scores come out on the Medicare website, and that's typically how, if you want to know that, you can go in and type in the hospital on the Medicare website, and it'll give you those patient satisfaction scores, and you can actually compare hospitals on how we do at each hospital, or you could go in and compare Okemah Hospital versus Shawnee Hospital to see who had that. So that's typically how those are reported.
But you won't have it reported. You won't be the one reporting.
No. Medicare, it automatically downloads that information from Medicare.
Thank you.
Questions? Roll call vote, please.
Mary Crawford?
Yes.
Joyce Deere?
Yes.
James Jennings?
Yes.
Anna Marshall?
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. PCA 20-002, the law of the Muscogee Creek Nation authorizing expenditure of the tribal self-governance program, planning and negotiation cooperative agreement funds awarded from the Indian Health Service sponsors, Representative Crawford. Representative Crawford made a motion for a due pass.
Second.
Second by Representative Jennings. Discussion. Representative Crawford.
So this grant, I apologize. The Office of Self-Governance worked on this in cooperation with the Health Department. We reported to this committee, although there are some new members here, that there's some opportunity to assume program services and functions and activities from the Care and More Service Unit, which is being operated by the IHS directly right now. So this grant will allow us to evaluate that process and determine whether or not that's a feasible assumption for us. So we'll be doing an operational evaluation and a fiscal evaluation throughout the grant award. I believe it's for 18 months, and primarily we're using it to support some of the legal fees that will be required to do the planning and historical evaluation. Care and More Service Unit has a really complex relationship with more than 10 tribes, and there's not a lot of historical information available from the area office, so we'll be constructing a lot of that. And we have been working with Cherokee Nation to try and facilitate discussions with them. They're the other primary tribe associated with that service unit. So we've been in discussions with them, and the planning grant essentially allows us to transfer costs that would have otherwise been assumed by the tribe to the Indian Health Service. Can I answer any questions?
Question, Ms. Prince? Thank you. Also, you see the language in here that the carryover to full extended, so that will cover through 3/31/2021, correct? So this doesn't have to come back.
Yes.
Thank you. Any other discussion? Roll call, please.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings,
Yes.
Anna Marshall,
Yes.
Chairman Jeff Warren, 0 against.
2 in favor, 0 against, that motion passed. Next item on the agenda, the other business. Discussion, health systems update, Secretary of Health, Mr. Terry.
Thank you, Chairman. Committee, we're going to try each month to provide you a comprehensive report on all of the things that are happening throughout the Department of Health. If you ever have things that you would like to see reported, please don't hesitate to ask. We've had a policy and practice of as much transparency as we can give. So we would like for you to be as deeply intertwined in the financial and operation reviews as you feel like you would like to be. We have 3 broad goals for 2020 that we're going to outline as far as improving patient outcomes, increasing patient access, and the financial viability. One of the things that we are really focused on quality data with our patient outcomes, trying to increase our physician quality and the measurements of that. Increasing patient access, one of the things that we track and monitor on a monthly basis is always our appointments, our kept appointments. Are we getting better at getting people appointments that need appointments? And that's something that we're always trying to vigilantly work on. And then always the financial viability. And as you all know, that the better we are financially, the more services we can give. And we can give things like raises, and we can do things as far as hiring more staff and more doctors, which gives more service. So anyway, those are the 3 broad outcomes. We are in our increasing access. We are trying to look at acquiring new land to expand both hospitals and clinics and programs. We are building our new behavioral health building out here at the Pecan Grove. We're currently looking at a couple of pieces of property to look at expanding the Only Clinic into a new location, and also Sapulpa Clinic into a new location. Ensuring financial viability. We continue just to grow our third party every month. We had a really slow month in December. However, we did have 5 days where our staff was on holidays, and so that's about $250,000 a day whenever we take a day off. So we'll play catch up in the next month, and we'll be back on track. However, we have been planning that in the future, we're going to try to get some outside contracted help so that when we do have times where we have to be off, we'll have a third-party company helping catch up with our third-party practice. You're going to see a lot of the public health programs in here and what they're doing out in the schools with immunizations and how many immunizations they're giving. The Studgy Fest is a community baby shower that we've been out working with the kids, and the public health nurses are out there with resource booths, doing presentations, door prizes. And then the diabetes program, they've been prescribing continuous glucose monitors. For those of you that are familiar with diabetes care, typically what happens is you have a glucose monitor that you're using every day. These continuous glucose monitors are hooked up and they'll be tied into your phones, and it'll give us data straight back to us. So that way, if you're having a problem today, we can do early intervention. So that way it'll alert us that they're having a problem, and we can get nurses to call you, or we can adjust your medications, and we don't have to wait 3 months till your next appointment. So we're hoping to be able to start making real-time interventions for our diabetics with this continuous glucose monitor. So we're excited to see what that's going to turn into. When you want to jump down into the financial viability, I think all of the metrics that you're going to see with the graphs that I'm going to show you, they're all trending exactly the way that we want them to trend. I'm not going to go through each one. I would like, especially for the new members that's on committee, that I would like Ms. Crawford, if you'll turn to the last couple of pages, you're going to see the financials for the Department of Health. And I'd like her to kind of just basically walk through these so that you know what you're looking at. Because if you don't know exactly, they can be a little bit confusing. So, Ms. Crawford, would you maybe do a high level?
I think the first page you have is one that says hospitals at the top, or actually it lists the hospitals across the, it just says November. So that is just a November statement of our hospitals. And then there's one that is a multi-column. So this year we're able to compare 19 to 20, which I'm really thrilled about, because I have the data now that we can actually do a comparison year over year and month over month from last year to this year. So one is just looking at November, and then one is a year-to-date, which is only 2 months, but it is a year-to-date comparison of 2019 to 2020. So the first column is our medical center, that's a hospital here in Oklahoma, and then Creek Nation Community Hospital is in Okemah. The LTAC and outpatient rehab, we separate that out from the SNF, even though they're in the same building, they are separate hospitals. So the LTAC and the outpatient rehab go together, and then the skilled nursing facility is the SNF. And then we do a total of total hospitals. The top part of the statement list shows the gross revenue. This is what we charge for the services that are provided, and we break that down by our financial classes. So we have Medicare, Medicaid, commercial, that would include all of the different insurance companies, the VA, and then Indian beneficiary. Indian beneficiary are any citizens or those who have cards that do not have other coverage. So if they don't have a Medicare, they don't have a Blue Cross, they don't have Medicaid, they're considered Indian beneficiary, and we do not bill for any of those services. Then we have self-pay. So for the hospitals, self-pay would be those who come in without coverage that are non-native. So in the hospitals, especially in the ERs, we do run a lot of self-pay because those patients come in and need to be seen. Down below that, we have contractuals, allowance, bad debts, and then Indian beneficiary contractual adjustment. So contractual allowance is the difference between what we bill to Medicare and what they pay us. So we may bill $3,000 for an MRI, they may pay us $176. So the difference between that is the contractual. Then typically you have a patient portion. If that is a native patient, that portion is written off to Indian beneficiary if they don't have a secondary insurance. So that's why you will see that the Indian beneficiary contractual is typically higher than the gross charges. And that's the reason, because you have a lot of patients that have one coverage, but they don't have secondary coverage, and so we're not billing them for their deductible and co-insurance. Does that make sense? Okay. Then down below that, we have our net patient revenue. That's what we expect to collect. That's what we are expecting cash-wise to get in. Then down below that, we have our operating expenses. So salaries obviously is the largest expense that we have in any of our health facilities. Under that is our fringe, and then the various other expenses that we have. Typically, contract medical, that's a pretty big expense, and in the hospitals, that's primarily the contract to the physicians. So our ER physician group that is taking care of patients in the ER, our hospitalist group, those all fall under that particular line because they're not employees of the tribe. That's down at the very bottom, we show what our annual budget is. We just kind of keep track of that on an ongoing basis. That next column that had the multi-columns, that's just so that you can look to see where we were at this same time last year. So October, November last year, 2019 compared to 2020. I would like to point out that there was a loan payment made for, against the loan for Creek Nation. Mr. Brownell, would you like to say anything about that loan payment that was made?
Yes, the health department paid $10 million in additional principal on the Okema note. So the note was going to renew in December for $49.3 million, and we actually paid off the note at $39.3 with the benefit of this $10 million payment. So health's payment significantly reduced their interest costs over the life of that agreement.
Thank you. The next statement is the clinics. So we break out our statements between the hospitals and the clinics. So the next one starts with Okema Clinic, Omomi Clinic, and so forth across the top. So we do the same thing. We have a monthly statement, and then we have a year-to-date comparison. This year, we are reporting the Coweta Refill Center, which is expected to begin services in April. And so we'll be breaking that out separately, and that's why that's a separate column on the report now, because it tends to move. We're actually moving staff, in some cases, from the clinics to the refill center, and then hiring additional staff to staff that. The clinics is the same format. Does anyone have any questions about any of this? I know I've probably talked too fast, but.
I think the only thing that I would add to the clinics, if you go down on the bottom, towards the bottom, there's going to be a line that says transfer in and transfer out. So you do see the profitability. We show the profitability if the clinics were just built freestanding operations on their own. But we transfer our IHS dollars into those accounts, which that's why we get IHS dollars, right? But not only do we pay for it with IHS, we also show you that if it was standalone, what it would be profitable-wise. So we're actually doing very well from a profitability standpoint at Omomi Clinic versus where we may not do so good at Sepulveda Clinic, and there's lots of reasons why. And if there was a problem, usually it's at a payer mix because our payer mix in Omomi is better, but that's some of the reasons why, but we track that.
I guess one other thing I need to probably point out too is that when we did our budgets this year for our clinics, because we had added services, but yet our IHS dollars remained the same, we added some of the cost into a third-party budget. So down at the bottom, under operating income loss, it has lab expense paid from third-party and commission core. The reason why we're showing this is because we want to be able to look at our clinics year over year and know, you know, are we doing the same when actually some of those costs are they're just being paid out of a different fund. That's all that means.
All right, committee, thank you very much. I'll be happy to answer any questions if you have any, or if not, that's our report for the month.
Questions for Bill? Representative Jenks?
Okay, so And then I have one other question about the athletic shoes program. So we have two, kind of, right? Two contractors.
Two contractors, I believe that's right.
So who's doing the assessment for these people?
Our podiatrist is
So
primarily,
go from my provider as a partner to the podiatrist to get an evaluation, but in years past, I had
I'd say that we have more than one mechanism. I would say that the majority of those, if you have some kind of a dietary issue, you're going to get a referral to it. But if you need to go outside, they do that as well. So we're not locked into just one, necessarily one way.
Thank you.
Representative Jennings, questions?
Sean, you got an extra report by chance?
We
If not,
take another piece together. Chairman, thank you.
Please go very much. Thank you for your report. Next item on the agenda will be announcements. There are announcements from the committee. Let's see here.
I tried to call everybody, CRD has a quarterly training, Friday morning, and that's going to be up to 9:30 instead of 10 o'clock. She said there were some programs that were included on the agenda, so they moved up to 9:30.
Thank you, Representative Jennings. Any other announcements from the committee?
We have 3 joint meetings that are going to be prior to planning next week. We're going to start at 5:45, 6, and 6:15, and those will be coming out soon.
Mr. Speaker. Is it going? Is it voting announcements? Chief, second chief announcements. Entertain a motion to adjourn. Representative Jennings made a motion to adjourn.
Second.
Second by Representative Beard. All in favor say aye. Aye. All opposed, same sign. I'd like to ask Representative Jennings to please give a recommendation.
Gracious Heavenly Father, we come to you in prayer. We thank and praise for all the blessings that you bestow upon us, this country, nation, the citizens. Father, we ask that you would give us traveling